The economic fallout from a government-ordered lockdown to stop the spread of the coronavirus has created an unprecedented demand on services like those provided by the Hawaii Food Bank and similar nonprofits who feed the needy on all islands. Requests for food stamps and other government assistance are also way up, as are the calls about domestic abuse. What resources are available? Where do people go for help? Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Laura Yamada. Hawaii residents have unprecedented needs as we enter another month dealing with the coronavirus. There's talk of reopening some businesses in the next several weeks, but many people are worried about tonight's meal. People who need help and the agencies that are helping them are stressed. As bleak as all that sounds, there are resources out there, but how long can they last? Our panel tonight includes the leader of a nonprofit that helps feed the hungry, the head of a government assistance agency, and a longtime advocate for domestic violence victims. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. All right, now to our guest, Ron Mizutani, President and CEO of the Hawaii Food Bank. The food bank gathers food and support from communities to distribute through charitable organizations to those in needs. Pankaj Banot is the director of the Hawaii State Department of Human Services, which provides food stamps and public assistance for people who are struggling. And Nancy Creedman is the chief executive officer of the Domestic Violence Action Center, which has also seen an increase in calls for help. So thank you all of you for joining us tonight. This is such an urgent need and continues to be, and also uncovering a lot of what we need. So Ron, let me turn to you first. Let's think about these long lines we've seen at the food bank. What is your take on this? Is it because people are running out of everything they need? Is it because people are uncertain and they're hoarding? How do you describe what's happening?
Good question. I think it all started really mid-March, before even the first positive case was made in Hawaii. And I think a lot of folks who are watching the news, social media, really has changed the way we look at and handle stress. But there was panic purchasing early in this, and no doubt about it, it's a behavior issue that a lot of us do. I mean, we've all jumped on the car and gone and filled gas and because a hurricane was on its way, and we did the same thing with toilet paper and everything else. But for this event, there was so many uncertainties, and I think that's what made people purchase the way they did initially. And I knew this would have an effect on the food bank in the long run, and this would be a long run event. We saw it in Asia, and we said, okay, this is going to apply to us as well eventually. Now, what we're seeing today is unprecedented. We just did a distribution today at Waipio Soccer Complex, partnering with the city and Hawaii Community Foundation and the Bank of Hawaii Foundation. Through their means and their funding, we distributed 110 tons of food today. And it still wasn't enough. Yes, we still had to turn people away, and it broke our hearts that we had to let HPD know that we're done. And the people that waited hours in line today, hours in line in their vehicles, the ones who did not get, we just want to let them know that you have opportunities to get food. Just go to hawaiifoodbank.org. We have 200 partner agencies that help every single day, but today's event was remarkable. And it also showed the strength of Hawaii and the Aloha spirit that is very much alive.
What are we talking about here? Say even just for the month of April, how much has been distributed?
Well, we look at things annually, and also monthly, because that's how we project our budgets. If we look back at what we did in March, and we kind of anticipated we'd see a spike. We saw an instant 30% spike in the first week of positive tests. That need increased about 60% in 2 weeks. We saw last week an 81% jump from last year, the same week. We went from distributing 260,000 pounds in 1 week to nearly 500,000 pounds.
So of course, you, as you said, you were looking at what was happening, how it was trending and moving toward Hawaii. But was there any way to predict or prepare for this kind of a spike?
I think what contributed to this, and I'm going to be very frank, as I've always been, and very, very public in my opinions, sometimes too much. What contributed to what we're seeing today literally in Waipio, is the fact that a lot of folks have not received their unemployment checks. That's the bottom line. People do not have money in their pockets to purchase food. And thankfully, the food bank and other partners out there, not just us, we're not the only game in town. A lot of people doing great work. Even new operations and new organizations have come forward. But that has contributed greatly to people's stress at home and the uncertainties of what tomorrow will look like. And it overlaps. There's a reason why all three of us are here tonight, because it really does overlap all that we do.
And same thing, Pankaj, when we talk about the public assistance that you're offering. Well, let's start first to remind people what type of public assistance your department does offer.
Laura, as you know, it's unprecedented times. In 21 years of my career in Department of Human Services, we have gone through hurricanes, volcano eruption, floods, and many other, an economic crisis of 2009 and 10. This is unprecedented. And the programs that we have we have the largest safety net in state of Hawaii in Department of Human Services. We have food benefits. We have financial assistance for families who are in need. So, say, for example, they have lost their income or they have other economic challenge that they're facing, they can apply for financial assistance. We provide healthcare insurance to low-income and working poor families. And we also have childcare assistance for those who are essential workers today and need assistance. We have that. We have a plethora of homeless programs to support the homeless population in Hawaii. And we also have programs to ensure the health, safety, and security of families, like child protective services or child welfare services, adult protective services. And we also have programs for those who are disabled, like services for the blind and services for those who are deaf or blind and deaf. We have services for those. We have services for at-risk youth during this difficult time. And also, I shouldn't forget the fact that we also provide housing services support for those who are unable to have their own places, rental assistance through our Hawaii Public Housing Authority, and also provide housing solutions as well at the same time. So it's a huge program.
So it's almost hard to kind of slice that up because it's going to take the entire hour just talking about all of it. But let's start with, say, food stamps, for example. What have you seen? I would imagine it's...
I cannot compliment Ron enough for what he's doing, and what he's doing through his organization and what they have done so far in the last few weeks is to me is unbelievable. We are seeing unprecedented increases in our SNAP rolls. In the last two weeks, 2.5 weeks, we are seeing close to 8,000 or 9,000.
SNAP.
The Supplemental Nutrition Assistance Program, which is formerly known as food stamps.
Okay.
So that's the food benefit that we provide to eligible households in Hawaii. We generally issue close to $460 to $480 million in 100% federally funded benefit annually in Hawaii. Comes out to like $48 million per month. And we serve around 150 to 160,000 people, generally speaking.
This is the norm.
This is, yes, the norm I'm talking about. What we are seeing is that there is an increase, tremendous increase, 80% increase in food applications.
Mm-hmm. Wow.
And we
How is the staff handling that? Are they able to?
Unprecedented times required very bold, aggressive, and out-of-the-box thinking. The best thing we did, which we could never do in a normal circumstance, we quickly put together a PDF fillable application and put it on our website. So people can access it, and we allowed them to actually submit it through an email box. Fax it, mail it, drop it off in a Dropbox in any office of ours.
Were there some barriers to that before?
Yes, because we do not have a modern system of eligibility. We are in the middle of building it, and we did not have a fillable online application, and it requires tremendous amount of approvals from the federal government. Mm-hmm. Because of this unprecedented situation, we got the waiver to put that on.
So some of that red tape and those barriers.
It's all barriers were gone, and we can do that, and we can take applications without signature and verify the signature via a phone call. How it has helped our population is unbelievable. We have 7,500 applications that we received in a 2-week period from 26th of March to the mid of April, and we have approved roughly 7,200 of those. And
And what might be on average outside of a situation like this?
we
compare the
were
numbers.
roughly getting close to maybe 250 applications generally per month.
Wow.
Wow.
And it's how much?
It's
now?
it's 7,500.
Wow. It's like protocols and procedures really have to be
Yeah.
put on the side.
Flexible.
No,
During
can you
these times-
imagine
during
if
these
we
times.
did that, generally speaking, for all times to come, life would be much easier and we would be far better poised and prepared to deliver this. And it has helped because, people are running out of food at the end of the month because our benefits go first week of the month, we issue benefits. And then at the end of the month, they are running out. Plus, they have also lost their jobs.
Yeah.
Unemployment insurance, only 1/3 of the cases have so far being approved or money has been rolled out. Rest of them are still waiting. So things are going to change as we move
Yeah, a
forward.
few weeks ago, we were talking to Department of Labor folks, and as much as they've put a crush of staff into all of this and they've done some improvements, still, a number of people filing for unemployment has just been so incredibly overwhelming for them. So we think about all of this, and really what we're talking about here is stressor upon stressor upon stressor upon stressor. And then you think about folks heading back home with all those stressors and being together. And it's, I would imagine, Nancy, that you are seeing situations that are really tough to deal with and to handle as a community.
Well, we are. We clearly are. I just want to separate out that the circumstances that we as a community are facing are not causing domestic violence. But when you have an abusive partner and you are directed to stay at home or shelter in place with that abusive partner, you're in danger. So the danger increases in those households where, not everybody's partner turns into an abuser, but the problem of domestic violence occurs behind closed doors. And with everybody behind closed doors, where that dynamic exists, the powerlessness that a person feels, the only person they have power over is their partner. And so that exacerbates the danger and the risk for the victim. We also, not in the same numbers, and for a lot of different reasons, I think, we are seeing an enormous increase in requests for help. And honestly, we're anticipating a landslide when this shelter in place is lifted. We're thinking victims are going to be running out of their house saying, he almost killed me. My kids are traumatized. I can't live like this anymore.
Just so you know, continue talking. We put up the domestic violence helpline numbers
Thank you.
for folks to see the Oahu number as well as the toll-free number.
Yeah, thank you. So we have to somehow meet the need now and imagine the landslide that we're going to have to contend with, which is pretty challenging because we're all talking about budget cuts and no jobs and no revenue. How are we possibly going to meet that crisis when it surfaces? And we as a community really have to think about that. In 2009, when we were facing that economic crisis, there was a lot of thinking and a lot of planning around the rainy day fund and the safety net and who needs what and how do we get food and how do we get unemployment and how do we get shelter and how do we get legal services and how do we make families safe? How do we take care of children?
I wonder, do you have any concerns, or how do you look at, when you talked about sort of understanding the stressors and what's different between what we're seeing happening in our environment as opposed to what's sort of an issue that happened internally.
Right.
Are you concerned at all about people who, as time goes on and we're in this unusual situation, being able to sort of understand and separate what's happening and why it's going to get more difficult, as far as the lines being more blurred, if you're, maybe if you're home for a long period of time thinking, well, this is happening because of that. This is obviously, people are stressed right now. They're not getting their paychecks.
Right.
So I understand. I can see why my significant other would be upset right now. So it's okay because it's just because of this environment. Are you concerned about that at all, as far as that kind of maybe settling in to people a little bit more when it's a distortion?
That's a really interesting observation, and it's already a part of the dynamic. People tend to minimize the seriousness of the situation they might be in if they're in a relationship with somebody who's controlling them or hurting them or threatening them. They're like, his mother died, or his boss is a pain in the butt, or something. It's like, it's really like, we're going to get over this. So there's already some denial and some minimization. I think that too is going to become more blurry, as you're pointing out. And people have fewer options. When you have no job and no resources, your options are pretty much reduced to none. So that's going to keep people in danger. And again, as a community, we have to figure that out. How do we lift people out of situations that are possibly life-threatening? I mean, that's our job as a community, because every loss belongs to all of us.
When we think about sort of identifying what the situation is, and all of you as leaders in the community and dealing with people who have these different stressors in different ways. Say, for example, if we're talking about people coming to the food bank, that you're providing for such a large part of our community, but at the same time, as you talked about earlier, you're kind of looking at sort of assessing who's coming through and who needs what, because resources are limited. Are you able to be able to say, hey, these are the individuals who truly need it? Maybe I don't want to say move to the back of the line, but and these are the people who maybe are taking advantage of a system. Is there even time to do that? That's
a good question, Laura. I think, and I always say this: the face of hunger is always evolving. You never know who's going to be hungry. We saw that during the government shutdown when TSA workers in uniform came to our warehouse in Mapunapuna in tears, because they all of a sudden had to stand in line for food. They didn't have their paychecks. And after the third paycheck missing, their stress level was high. They're not going to pay their rent, their utility bills. And so we saw a different face come through. And I always have to remind not only our team, but those that we reach out to and other stakeholders, is that's going to happen. We always talk about Hawaii, we're a paycheck away. Well, guess what? We're in a paycheck away issue right now. This is a crisis, and I'm not a sky falling guy. My cup is literally, but not right now. But my cup is always half full when it comes to stuff like that. But the reality is, we are in a crisis, and we have to. It's an opportunity too, though. I mean, we're learning so many lessons right now as a community, even as a food bank, and how we operate. And we talk about sustainability and being a part of that the conversation about good health and providing healthy options. So for me, when I look at those coming through the door, I don't know if somebody's been laid off.
Right.
Somebody came through the line today with a beautiful BMW 700 series vehicle. We don't know their situation. I dealt with hunger when I was a child.
Right.
I mean, people don't understand that. So you never know who's hungry. You never know why. And for us, we have to keep that always open-minded.
Or how close they might be to that tipping point. So here's a question. Before the pandemic, people were paycheck to paycheck, working 3 jobs. That's what they're saying about themselves. This is Scott. There was no plan for the food shortage, at least in his mind. So he's looking and saying, I guess this really was a question maybe coming up as far as looking forward, but he's saying, I mean, how do you, when we're going paycheck to paycheck and we're trying to, see what resources are out there, how am I supposed to think about what's going to be available? How am I supposed to think about whether or not I'm going to expend the energy to go and see if there's food at the food bank? Or I think he's kind of got a twofold question here about his situation now and how we're dealing with it moving forward.
I think I'm not going to assume what he meant or the intent of his question or what he was trying to get across to us. But I do know that, when we looked at inventory, and that's how you base if you can match supply and demand, it's pretty simple economics, but really right now it's not. How do you manage that, right? And when we look at projections, I mean, nobody prepared for COVID. And nobody had any idea how tough that would be. If I look at my monthly budget in the spring months, is $33,000 a month is what we purchase food because we get donations. We live on donations. That's 10% of what we do every month is through purchasing. That has now increased to $700,000 a month in a matter of a month. And as we look forward into May, and thankfully we've got a very giving community, we're looking at purchasing $2 million worth of food. My budget for the entire year is $400,000.
Well, maybe I should ask you the question this way, whether it be either for you or for you. How realistic is it to think that we should be preparing for something to this extreme? When we think about that there will always be limited resources and there will always be competition for those resources,
Sure.
whether it be through different fields, different departments, different levels of government. How do we need to think about that?
I think the Department of Human Services, since it's a partnership between the federal agencies, the Department of Health and Human Services, and also a U.S. Department of Agriculture for the food benefit, and for other benefits is Health and Human Services, we are actually prepared for this in a sense that food benefit is 100% federally funded benefit. And the healthcare insurance is federal and state combination. So these benefits are available. People can apply for these benefits. Go to humanservices.hawaii.gov. We have the information available, and vast majority of people who have lost their jobs or are struggling to meet their basic needs, they can apply. My worry really is that people should not be conducting their own eligibility because it's very nuanced and very complex.
What do you mean by that? By their
Means
own
going
eligibility?
going onto the website or talking to a third party and they say, oh no, you make too much money. Or if you get this unemployment check, you may be ineligible. But that's not true because there are so many different factors go into it to get to your certain net income for you to be eligible. You may be eligible. Let us do the eligibility. You just simply apply. These benefits are for you during this difficult time. You're not going to apply when you have a well-paying job. You don't need it. You don't need to go to a food bank to get food because we can provide you with that support during this difficult time.
So Veronica from Mililani's got a pretty straightforward question. She says, how can I get food stamps and how long before I qualify? So I think she's kind of getting, so what's your answer right now?
All right.
No, but what's sort of a, how can she can kind of gauge that at least from a time frame and what her, what does she need to think about?
Say she is in need. She applies, goes online, fills out the application, turn it in. We can turn that around in 48 hours. That's our average today. And to me, it is unbelievable what our staff is doing.
Wow, yeah,
because
excellent.
normally, if you look at the normal period, federal law allows us 30 days in a normal case, in a regular case, that where there is income.
Or within 30 days.
Within
you
30
need to
days, we must
process.
determine, dispose the application or disposition. In expedited cases where there is zero income or homelessness, we must dispose an application within 7 days. In all cases, we are averaging 48 hours
Wow.
to conduct eligibility, and then it takes 3 to 5 days for the EBT card to get to them. Because we are
incredible.
issuing EBT cards out of our offices. Replacements, stolen, and other lost cards, they are coming directly from our FIS, the vendor from Florida. Those are different cases. But we are issuing benefits very, very fast. And let me give you another example of the Medicaid, the health insurance. If you apply online, which we are encouraging people to go to mybenefits.hawaii.gov, if you apply there, we are actually doing eligibility within 24 hours.
You know, and this is I have to ask this question, and this is kind of similar to what I asked Ron about screening in a sense for people who maybe are this is not the best way to put it, but maybe most deserve it in some sense, or maybe the most needy of these types of services. So same thing I would ask is, and again, maybe it's unfair because we're in this unusual situation and we just need to kind of get that help out there. But would you say in general then that the screening for individuals to be able to qualify for these services has been reduced or changed in a way so that the process can happen more easily, more people can get assistance. How would you explain how things have changed as far as people being able to get these benefits?
I'm so glad you asked, because that was the proactive thing the department did. We anticipated that this is going to hit Hawaii. We started to apply for federal waivers and suspension of certain rules and regulations in Hawaii very early on, before even it became a big issue. And we had our applications pending before the federal partners early on. For example, we knew people are going to lose their jobs.
Right.
We got the waiver that they don't need to verify their employment hours. Say a person who is able-bodied adult, right, without children, a single adult, they are eligible to receive SNAP benefits or food benefits for 90 days if they don't have work requirements met. That's 20 hours per week they must meet in order to be eligible to receive SNAP on an ongoing basis. If they don't have a job, they only can get benefits for 90 days. But with anticipation of this downturn and loss of jobs, we were able to get a blanket waiver. So they don't need to now provide verification of their work hours, and they can continue to receive benefits throughout the pandemic. That was preparation, anticipation, and execution. You have to do it, because otherwise we are going to have longer lines,
Right.
more concerns that Nancy is talking about if we did not take that action. And it required processes to be streamlined, archaic, arbitrary, and many other sort of rules and regulations that are very sort of strict, and frankly speaking, some of them are just barriers, were eliminated. And that made it easier for us to take care of families and individuals and children now than wait later on and figure out you're eligible, you're not eligible. And in the meantime, there is hunger, there is poverty, and there is despair, and then there is domestic violence. I can't have that as a director of human services.
And no doubt we're going to circle back to kind of sort of moving forward, sort of what happens. But I want to kind of bring it back to Nancy and sort of thinking about things, the way that things have changed and how you're having to adjust as far as reaching out to people, getting them to respond, understanding sort of how their situation may have changed in some capacity. How have you adjusted, or what have you seen needs to be adjusted to be able to then reach these individuals who may not be as accessible or as willing to be forthcoming because of their current situation?
We undertook sort of a similar process. We could see very early on that domestic violence was going to be a consequence of COVID-19, and we immediately added a text feature to our helpline, understanding that people cannot make a telephone call with their abuser standing in the next room or standing right next to them. They might be able to text. Everybody's texting these days. We also added a chat feature to our website. People are working at home. It looks like they're working. They can be sending a message saying, I'm in danger, I
So
need
they would
help.
go to your website.
Yeah, they
and
go
then
to our
there's a
website.
chat box there on the website.
Pops up, just like if you're going to, anthropology, the chat box pops up, and you send a message. And we respond to you immediately without you having to say anything out loud or having to disclose that you've asked for any kind of help. I think, what Pankaj was talking about is, and you left out, the vision that they had. They eliminated barriers, they got waivers, they executed, but that involved some vision. And I think as a community, and I think you described that as well, you could see certain things. You needed to increase your stakeholders, your funders, your partners, your approach. That's what we had to do. We had to use some vision, understanding our constituency, the people we were born to serve. What do they need? How do we make sure that we're reaching them to meet their needs?
So what's been the response to those
It's been
changes?
enormous. It's been enormous. Our chats, our visits to our website have increased 77%
Wow.
since February. Now again, that doesn't necessarily mean a person chats and then makes a life-changing decision. Making any kind of a decision is a big undertaking. It's a
You need
huge
and want
step.
that communication
But you
and
want to be able to
connection.
think about it. What
Yeah.
are my options? Do I have any options? What are they? How do I take a step? We've encouraged our staff to make repeated contact with clients on our caseload now to do a lot of safety planning. Because the safety plan changes. When circumstances change, risk changes, and so you need new safety plans.
You know, if you think about it, from the victim feeling safe enough to communicate, for a lot of individuals, I would think that this type of step, this initial step, would be easier and feel less threatening or difficult or not as big of a hurdle as opposed to maybe physically going to a shelter, actually, reaching out and having an appointment with a counselor as opposed to just finding a way to communicate initially and breaking that silence first.
Our contacts through our helpline with our text feature and telephone has increased 68% in that same time period. I think that we're seeing an increase. I mean, at first, people were, kind of moving around the risk and minimizing it a little bit more. And then you get to a point where you're like, I can't ignore this. This is scary. I'm afraid. My children are afraid. So we're seeing the increase really now. I was sort of interested to hear you say that in early March, people were already, it's like they were just beginning to lose jobs. And so, it was really quick. Yeah. Our experience is a little bit different, that it takes a little bit longer. It's a very different kind of a step. Once I admit to myself that my partner could hurt me or could kill me, I kind of have to do something about it. I can chat a lot, I can text a lot, but ultimately I'm going to have to do something. And what is that? So we're trying to figure out, how do we develop relationships with hotels or Airbnbs for longer term stays? How do we work out transportation? Person doesn't have transportation. How do we get people the devices they need to even chat with us? Not everybody has a laptop or a tablet. We inventoried our staff to see on our current caseload. We have about a little more than 300 people on our caseload. So we asked them, on your caseload, how many children and how many survivors do you think need devices, iPads, tablets, laptops? 110. I mean, where are we going to get 110 tablets? We don't have any tablets. So, but again, if you're homeschooling, not everybody's equipped to, I couldn't homeschool anybody. Not everybody can homeschool somebody, but then if you don't have the devices, how do you do it? So we're sort of trying to figure out, and then tutors. Kids need tutors.
How has it been as far as funding and as far as accessibility to resources?
Well, that's always a big challenge.
Yeah.
We have been blessed by a couple of incredible gifts. Summit Media, that operates FM 100, KINE 104 in Crater, adopted us, and on all 4 stations, all day long, all their on-air personalities are talking about domestic violence and talking about the Domestic Violence Action Center, driving people to our website and driving people to their Facebook pages for information and to make a donation if they'd like. We got an unsolicited gift from the Harold K.L. Castle Foundation. One of their staff had a neighbor who was experiencing domestic violence, which really touched them deeply, and they started talking about it at work. And so the executive director of the foundation called me and said, "How's it looking over there?" I said, "Well, it's looking kind of scary," and we got a gift from them. We just recently got a very generous gift from the Weinberg Foundation, but we're anticipating some gigantic cuts. I mean, there again, no revenue, no visitor industry, big state budget cuts. So I don't know how we will make those up.
I think that's why it's so important that the Medicaid, the health care coverage, and also the SNAP benefit and other federal funded benefits, that is a combination of federal and state funded benefits, these are going to remain unless serious cuts start to happen at the federal level. So far, they are not. So it's a great opportunity for us to now assess where we are, prepare ourselves for that moment when eventually legislature comes into session or it happens in next session in January. We need to be ready. I want to talk a little bit more about the response that we are getting. in 21 years of doing this, we are getting so many positive responses from the community, thanking us that we used to get more complaints about how we are not doing good, to thank you for taking care of us when we needed the most. That is an average comment that we are receiving throughout our mailboxes across the state. People are responding because we stood up and we got counted when it was needed, because we needed to come through. And we did.
Well, you think a lot of people are revisiting these resources that have already been there and for quite some time, and now taking another look at it and saying, hey, this is something that I need to figure out how to connect with. And I need to get some of these viewer questions, because there's quite a few that are sort of asking various questions related to the food bank and, what they feel that their needs are and what you may or may not be able to do. So Mike from Manoa asking, are you planning on holding food drives in Kaka'ako, not just in, say, areas like Waipio and Waianae? What's the thought there?
Well, if you go to hawaiifoodbank.org, first and foremost, I want to keep reminding. I wish I could put that on a crawl all day long, especially during COVID.
Your forehead. Put
I
on
wish
your
I
forehead.
could. And every station is a PSA, because there are food distributions every single day in every neighborhood, every single day. It's
So they're looking at these specific
so when you have these
locations when it's really
publicized
much
events
more.
like what we had today
Yeah.
in Waipio, and it was to fill a gap. It was not meant to slight any community by any means. We all know that hunger is an issue in every community. But there are opportunities to have food every day. We have 200 partner agencies that do this every single day. So there's always that chance of opportunity for food. I do want to stress that, when we looked at COVID-19 in March and we talked about what could come our way, we have the big Pacific Ocean in front of us. That is a huge challenge for a food service like ours, because we knew retail was going to slow down, because donation we knew was going to come to a full stop, really. We had to make some proactive purchases before we even had a positive. I couldn't wait 8 weeks to make a decision. I had to get containers on the ocean before we had an inventory issue. So there was that vision, if you will, to think ahead, knowing that people like Mike and Mano would have to have food come May and April. Right. So to a long answer to his question is, we have opportunities right now, every single day. Will we do a big distribution in Kaka'ako? The goal is to do a distribution in many neighborhoods, and I wish I could do one every day and in everywhere. I mean, I have Auntie Dottie and Ha'ula calling me, Ron, what about me? And Waiamanalo, but we have agencies serving those communities. It's also, we have to think about when we have something that's massive, and we saw it on the freeway today, it's going to create traffic problems. And so we have to be mindful and be good neighbors as well. And it's tough. It's very challenging, but it's yeah.
Lots of a variety of questions kind of surrounding what you're talking about. I think this is a
Top
big
of
event
mind.
that happened, so
Yeah.
it's top of mind for folks. So Jaron asking, or Lola, I should say, asking, how do you decide how much food is given to each car? Can the cars that don't get food get a waiver, be first the next time, redirected to another site? She's calling from Hawaii Island, kind of wondering, is there some protocol in place, or is it right now you're just trying to kind of get it out there based on first come, first serve?
Well, right now it's access for all. It'll always be access for all, and so we cannot say, what I want to do, and I'm thinking we a lot of lessons learned today, is how can we best serve our communities, even if it's at Aloha Stadium, and maybe do like, okay, we're going to do Ko'olau Poko today. If you live in the zip codes from Kahuku, I'm just throwing this out there because I thought about it today because I knew everybody was.
Wheels are turning.
Oh, the wheels are constantly turning. That's part of my problem.
Yeah.
But
They're spinning
we
right
have
now.
to create
I can see the fire
out of the
coming out of
box
his head.
thinking, and
Yeah.
even if it's a central location like this,
Yeah.
where it can handle traffic and flow and minimize the impact on communities, because we don't want to be that guy, right?
Yeah.
You have to think, okay, how do we serve Ko'olau Poko, but in Aloha Stadium? And how do we serve Waianae, maybe in Waipio? So we're going to go back to the city tomorrow and lessons learned on how we can be a bit more efficient and minimize the traffic issues. But as far as what goes in each car, we made a sound decision based on what we know families need. And if you had a household, if you have two households, you got X amount of food. Those are studies that we've done. Feeding America helps us. We know what a meal, how long it can last. And that's what you got today. What folks got in their cars was phenomenal. I mean, they don't think most of them knew what they were getting because we asked them to have their trunks open, and they didn't probably get home. I mean, until they finally got home and said,
they open it up and
"Wow,
say, wow.
You know, and it was
Beautiful fresh produce.
beautiful fresh produce, fresh beef, and a lot of healthy options.
So Sandy asking, so going back to that crawl that I think you need to have, because she's asking about the food bank location and hours, but also what are the qualifications, or are there qualifications of any kind to receive food? She's wondering about maybe having to show an unemployment letter or something.
Yeah. So if we have a USDA food, we have TFAP food. All of the programs with federal government, you have to a certain amount of level of income, and so there are parameters for that. Certain foods.
So when they're there and they're driving up and that's
access
different.
for all.
That's a different
Yeah,
situation.
we do not discriminate. We ask a few questions, nothing invasive, because we're trying to gather data as well. How many people are you? And in this case, we did ask for the city, are you recently unemployed because of COVID? But other than that, it's always access for all. And we cannot discriminate. If it's food that's coming in from our loyal donor base, we have to provide for all.
So here's a question for you, Pankaj. What programs are in place so that no one? Well, this is a broad question. What programs are in place so that no one becomes homeless? I think that's all of them. I think it's all of the above.
because we have homeless programs office that provides a lot of support for shelter related services. We provide housing supports, the Housing First and many others, our Section 8 vouchers through our Hawaii Public Housing Authority. They have relaxed a lot of those conditions, and they are making sure that rent, if people are unable to pay rent during this difficult time, they have waived those rents. There's a lot of good is going on, and all these programs eventually would lead you to be safe, healthy, and continue to thrive because there is support available through various different programs. And it also includes, utility shutoffs. We have programs for that. We have programs to pay rent if there is a situation where you may get evicted or there is a scenario. But evictions and other things are at this point are suspended because you can't evict. So now
what is for how long now? Is it until the end of May?
To end of May.
End of May.
End of May. And our
Evictions are suspended.
Our specific program-related waivers and exceptions and suspensions are all the way through the quarter in which pandemic is going to end, because there are very specific authorizations the state has from the federal partners, and the state laws that have been suspended, they are for a very specific period. So we would have to keep an eye, because I truly believe it needs to go, in my humble opinion, all the way to December 31st of this year for us to really understand what are we dealing with once we start to incrementally open our economy and businesses start to open, and what are we going to see at that time?
You know, I see what you say is so interesting, because when I look at Nancy, and when Nancy said, well, we're going to even see more.
Yeah.
Yes.
And I'm on the other side
Yes.
saying, okay, when the economy comes back,
Right.
at least we'll see an ease in hopefully needs. But
Right.
it's
gonna be different, yeah.
We're seeing
It's gonna be different.
Totally different.
It's going to be different,
Because I think why I'm so thankful to Nancy and her advocacy, I've known her and you and Nancy for a very, very long time. I think the key is what is coming. We need to be prepared, because avalanche or the floodgates that Nancy thinks are going to open, they are, I think, going to open. And we also have to be concerned about, we are taking care of them today. We probably need to take care of them longer, particularly those that Nancy is going to say, take care of them in the hotels and other places to make sure they're safe and secure. Now, we need to have other programs and services to continue to provide once this is over.
Right.
They need to go back somewhere.
Right.
So with the feedback that you're getting, or the responses that you're getting through the text, through the chat box, and how things have been building, has that given you a lot more, I guess, intel to work with, and to say this is what's more reinforcement as to where you need to either shift or refocus certain resources, whether it be based on what's happening right now or just being able to have more communication and more response? Is that Is that something that's happening because of the systems you have set up right now?
Well, we're sort of functioning on multiple levels. We're like thinking about now, the people who are already receiving services from our beloved staff who are bearing witness to the suffering every day. And then we have to think long term, what is it we have to put in place, like Pankaj just said? What kinds of needs do the people we're serving now have? What kinds of needs will the people we haven't met yet, what kinds of needs are they going to have? I mean, when we're talking about the economy opening up, that doesn't necessarily mean visitors are going to start traveling here and hotels are going to be fully operating. And I mean, we're going to be rethinking a lot of things as a community, I think. And
Go ahead.
No, go ahead. It's okay.
Do you, even though you're getting a lot of people going to the website, you're getting more people texting, you're getting people communicating through the chat box. All in all, though, do you suspect that there are a lot more cases going unreported?
Oh, definitely.
Yeah.
Most definitely. That's also always been the case.
Yeah.
I mean, it's very embarrassing to be a victim of
domestic. How would you explain the communication that's happening now and how you're able to use that? Because it's a little bit different because people are having to communicate in different ways.
Well, it's ramped up our advocacy quite a bit. I mean, I'm so happy we're having this conversation. I've been watching panels of economists and healthcare and government leaders, and nobody's talking about domestic violence or hunger or the intersections among these things. I mean, we have just opened a small apartment complex for survivors of domestic violence. The intersection between domestic violence and houselessness is gigantic. We took over the apartment complex because we have many, many clients who are homeless. They're living in their cars, or they're couch surfing, or they're staying for a short period of time with a family member, but that generosity runs out, that hospitality runs out. As a community, we have got to see that domestic violence is a core community challenge, and we have to connect the dots. Nobody's really talking about connecting the dots.
One of the reasons when we came up with this vision of this today's,
Yeah.
it was flawed in many ways. Let's put it this way: opportunities to learn. One of the first things I did was I got on the horn and I called Nancy.
Yeah.
And we had connection. We wanted not just this to be a food distribution.
Yeah.
I wanted it to be a community event. It was an opportunity
Yeah.
to not highlight, but to make sure that folks were aware that there was help, not
Yeah.
just for food.
Right,
So that's why we said, come join our effort.
right, right.
And I'm glad you said
Yeah,
yes, by
yeah,
all means,
yeah.
let's be a part of that. So I think these are good conversations to
Yeah,
have, and
yeah.
more and more people, and you and I both are advocates of domestic
Big time.
violence.
Yeah.
And
Big
we need
time.
more people to do so.
Here's another quick question here, fellow from Waikiki. What about people who don't have a car? They're talking about access.
Right.
So here's an access question. What about people who don't have a car? How can they get groceries?
There are different ways to get groceries. Excuse me. It's, again, in every community, there is a food distribution. You don't need a card to get food from those food
Again,
distributions.
it's kind of the focus on those
Yeah.
main.
Again, this is today's
distributions
event
that-
really
yeah.
makes it but it highlights hunger, and that's a positive. I always say an opportunity in challenges. It's getting the people conversing about this subject.
Right.
So that's a good thing. And again, I'm going to work like heck with my media friends to see if we can just do 24 hours of saying, go to hawaiifoodbank.org for a food distribution point near you, because they exist. And so in Waikiki, you can get something. We can also call 211 and have ways that other partners do home-to-home delivery. Right now, especially, there's so many options out there for help when it comes to food, whether you be a kupuna, where you're a keiki, where you're a domestic violence survivor. There are options right now for you to get food.
So these are questions maybe more obviously directed toward you, Ron, but really I think in many ways this applies to everyone about sustainability and sort of empowerment within our community. So these questions in particular, though, Tommy from Hilo saying, how do we become more self-sustainable in regards to our own food supply and food security? 1,000 years of Hawaiians were hit by disease, but they didn't go hungry because they were self-sustaining. Hawaii needs to do that now. And instead of passing out food, they should pass out seeds and fishing poles so they can provide them
Amen.
for themselves. So even now, even though that we're in the heat of all of this, people are sort of looking at, my goodness, what are we, I think, really looking forward and saying, okay,
Gotta
we're
change
in
the
this now
conversation.
still, but how are we are we thinking yet, or able to think yet about how we're going to move this forward and learn from this? And maybe shift in ways that we've been needing to shift for quite some time now.
The iron is hot right now, and it's prime for this conversation.
Yeah.
We've been trying to have it for
30 years.
over years about self-sustain. When we talk about Hawaii being sustainable, and he's right, we need to have our farmers farming for a reason.
Right.
Keep them farming, especially during crisis. Right. This is something that we've been advocating, at least at Hawaii Food Bank the last 2 years especially, that we need to have incentives for our farmers, for our ranchers, for our longline fishermen, to keep on doing that. Right now we're learning the hard way because there's no inventory in Hawaii. There really isn't. I mean, you can go to Foodland Times if you have money and access to that. You can get your groceries. But the reality is, for us, I have to sit in a queue with the rest of the food banks across the country, and I don't have access to food. That's why we're buying local. That's why we're buying the farmers, and we're getting the full produce in from our farmers. And it's an innovative approach. It starts the conversation about sustainability, and it gets our economy moving even during a crisis.
Well, it also eliminates waste, right?
Absolutely.
I mean, they're throwing away food because
They're
there's
plowing it right back into the
restaurant,
ground. There's no
there's
reason to
restaurant,
do it.
yeah.
So I want to
it
make
doesn't
sure I
make
get
no
to this
sense.
for each one of you, because we don't have that much time left. But when we're sort of looking forward and sort of looking at what's happened and what's been able to happen because barriers have dropped, because collaboration and coordination has happened, what are you focusing on at this point as far as what you can take and move forward and or hold on to that you feel can be sustainable? What do you think is going to stick to the wall, or you're going to fight the hardest to make sure it does stick to the wall?
I think we are learning a lot. We have learned that we actually have tremendous capacity to adapt. We didn't know with archaic electronic systems that we have, archaic processes that we had, we were able to just totally shook them loose. And now we know that we have ability to do virtual desktops. We don't need office spaces. We can work from home and be more efficient as well there. And we know social distancing is going to be the norm as we move forward. It's not going to be the regular normal that we had in January. We need to make sure that our staff is able to adapt and work from telework, from home, also work from the sites that we have. We also are learning that certain processes that we have now changed to and adapted to are far more effective, and that has given us the blueprint for the business process transformation that is required to sustain and become more resilient if this sort of thing happens again. One more point I will make is that last year, we did a big exercise of what would be the face of human services in 2035. And we knew this, we were never thinking of this as a crisis. We were looking at changing economy, climate change, and perhaps some of those things, how they are going to impact Hawaii. And
I only have a couple of minutes left, too, so I want to make sure I get back to Nancy, too. And we think about not only maybe the way that the program has developed or shifted in some way, but also the collaboration that maybe has happened or strengthened. How are you looking at that opportunity for collaboration and for streamlining those resources or building the resources that you need?
Well, we've always really believed in collaboration. I mean, we can't do this alone. This is way bigger than we are, and there's a role for every sector to play. And so this has really just confirmed that for us. And our friends and allies have come out of the woodwork. Entertainers, elected leaders, community organizations, government leaders. We have got to get the community to understand that domestic violence is not an isolated problem, that it does not discriminate, that everybody has a stake in making sure we have safe families, because safe families are at the core of a healthy community. And if we miss that, we miss the whole thing. So we're gonna keep at it, and we need the community to stay on the journey with us.
And Ron, we got people asking about how they can contribute, how they can help, wanting to offer their Social Security to people on Maui. Thomas wanting to call in to volunteer. I think a lot of people are concerned, and they want to know how this can be sustained.
It can be sustained, and it is already. I mean, we're learning some valuable lessons. And first of all, I want to tell you, Nancy, I have tremendous respect for you. You've been a dear friend of mine for so many years. Doc, what you've been doing is fabulous. You know, I used to harass your department when I was a reporter, so you've done a great job. But yes, please, by all means, go to your local food bank. We're a state network of food banks. Maui Food Bank, the Food Basket on Hawaii Island, Hawaii Food Bank on Oahu, and Hawaii Food Bank on Kauai. You have opportunities to make a difference in your communities, whether it be your hard-earned money or your dollars, the can of tuna that you can donate, or your time. There are opportunities to make a difference, and people are responding in a very dear and great way.
Well, thank you to all of you for being here, because this is continued conversation, and this is a call to action for and keeping that momentum going for some changes that needed to happen, and some collaboration that needed to happen, and more attention on these programs that are so important to our community. So before we go, we want to remind you that for information on COVID-19, just check out our website, pbshawaii.org. So thank you for doing that, and for all of you who have already done that. Mahalo to you for joining us tonight. And we thank our guest, Ron Mizutani, President and CEO of the Hawaii Food Bank, Nancy Creedman, CEO of the Domestic Violence Action Center, and Pankaj Banat, Director of the State Department of Human Services. Thank you so much again, all of you, for being here.
Thank you.
All right, next week on Insights, Hawaii lawmakers from the state and federal governments join us to talk about what they're doing in the battle against COVID-19. Please join us then. I'm Laurie Amata for Insights on PBS Hawaii. Ohui ho.